When we talk about making decisions, we often take for granted our ability to do so. But what does it really mean to have decision-making capacity? It's the ability to understand information, weigh options, and communicate our decision. This ability is fundamental to our autonomy, especially in healthcare, law, and ethics. In healthcare, it allows patients to be active participants in their care. It empowers informed choices about treatments and end-of-life care. Without it, individuals are vulnerable to having their wishes disregarded. The law ensures individuals are of sound mind for significant decisions. Ethically, it's about honoring individual autonomy and promoting dignity. Welcome back to Critical Thinking Secrets, the channel that gets you to think, well, critically. Our ability to make sound decisions is influenced by a complex interplay of factors. Mental health plays a significant role. Conditions like depression, anxiety, or dementia can impair our thinking, emotions, and judgment, making it challenging to weigh options clearly. Cognitive ability, our capacity for thinking, remembering, and reasoning, is another crucial factor. When cognitive function is compromised, whether due to age-related decline, injury, or developmental disability, it can hinder our understanding of information relevant to making choices. Autonomy, the freedom to make choices based on our own values and beliefs, is at the heart of decision-making capacity. External pressures, such as coercion from family members or healthcare providers, can undermine autonomy and hinder our ability to make truly informed decisions. Informed consent is a cornerstone of ethical healthcare practice. It means that before any medical intervention, patients have the right to receive clear and understandable information about their condition, the proposed treatment options, potential risks and benefits, and alternative approaches. But informed consent goes beyond simply providing information. It requires that patients have the decision-making capacity to understand and weigh this information. This ensures that their consent is truly informed and not given under duress or misunderstanding. If a patient lacks decision-making capacity, healthcare providers have an ethical obligation to find alternative ways to involve them in decisions about their care. This might involve consulting with family members or designated decision-makers who can act in the patient's best interests. Capacity versus competence. Two different worlds. Capacity is a clinical assessment by healthcare professionals for specific healthcare decisions. Competence is a legal determination made by a court of law. It refers to managing affairs, including financial, legal, and personal matters. A person may be capable of making healthcare decisions, but incompetent in managing finances. This distinction impacts who can make decisions for an individual. If lacking capacity, healthcare providers consult family or designated decision-makers. If declared incompetent, a legal guardian may be appointed for broader decisions. Section 5. Assessing capacity. A closer look at how doctors decide. Assessing decision-making capacity is not a one-size-fits-all approach. Healthcare professionals use various methods tailored to the individual and the specific decision at hand. The assessment typically involves a conversation with the patient to evaluate their understanding of their medical condition, the proposed treatment, and the potential risks and benefits. Doctors may ask patients to paraphrase information, explain their reasoning for choosing a particular option, or answer questions about their understanding of the consequences of their decision. The goal is not to test their medical knowledge, but to gauge their ability to process information and make reasoned choices. In some cases, standardized assessment tools or consultations with specialists, such as psychiatrists or neuropsychologists, may be used to provide a more comprehensive evaluation of cognitive function and mental state. The assessment process is ongoing and can change over time, depending on the patient's condition and the complexity of the decisions they face. Section 6. The changing nature of capacity. Adapting to life's twists and turns. Decision-making capacity is not a static state. It can fluctuate over time and vary depending on the decision being made. A patient who is capable of making decisions about their daily routine may not have the capacity to consent to a complex surgical procedure. Factors like illness, medication side effects, or changes in mental state can temporarily impact capacity. In such cases, healthcare providers must be vigilant in reassessing capacity and adjusting care plans accordingly. It's also important to recognize that capacity can be restored with appropriate treatment and support. For instance, a patient experiencing delirium due to an infection may regain their decision-making capacity once the infection is treated. Similarly, an individual with a mental health condition may regain capacity with medication and therapy. Thank you for joining us today. Enjoyed this video? For a more in-depth analysis, visit our website, www.criticalthinkingsecrets.com, to read the full article. Please like, share, and subscribe. Don't forget to hit the notification bell so you stay up to date with our latest weekly released content. We have over 100 videos on our channel to help kickstart your critical thinking journey. Till next time, keep those critical thinking gears turning. Thank you for watching.